Okay, so welcome everyone. My name is Jay Otto. I'm with the Center for Health and Safety Culture. And I think just before we get started, we'll have Shelley Baldwin just do a brief welcome. So take it away, Shelley.
The way we're going to change the culture, one of our methods for changing the culture around this is to have lots of really good conversations. And that happens when we can be in person with people. So I would encourage you, if you haven't already thought about how you might give and who you might give this presentation to, I encourage you to do that while we're thinking about it here. I'm really thrilled we had over 72 people sign up to listen in today, and there's 10 people with me in this conference room right now, so there's even more people than just that. At the end, I'll come back and give you a few more information, but Jay, we're so happy to have you here. Please take it away.
Great. Well, wonderful. Well, thanks, everyone. So very quickly, just as an introduction, I am a research scientist with the Center for Health and Safety Culture. At the center, our research really tries to explore how culture influences decision-making that influences health and safety. We principally do work in three broad areas. Historically, we've done a lot of work around preventing the misuse of substances. We also do a lot of work on traffic safety, and we're doing more and more work around violence, child maltreatment, child well-being. And of course, we know these topics overlap. We know that the misuse of substances heavily impacts traffic safety, and that's clearly one of the issues we're going to talk about today. So we really like working in those three different domains and to see how communities, states, and the federal government approaches improving health and safety in those domains, because they really approach them very differently, especially at the federal level. But it's interesting at the community level where things are really happening. You all are working in multiple areas and sort of have to bring it all together. So yeah, those are quickly our core issues, and together these core issues really contribute significantly to public health, or the lack of public health. Combined, these are leading causes of years of potential life lost, and so we think this is also just a critical area to focus in terms of improving the public health of the nation. What we're going to do today is really look at talk about some just general tips for presenting what might be challenging content, or what we feel is challenging content. And I think you could apply these tips to any aspect of your work. We're then going to go through and do the presentation, sort of review it, and then have a chance for questions and thoughts at the end. So we are looking at this maybe clearly running over an hour. I think we originally budgeted about 90 minutes. We'll see whether we need the full 90 minutes, but we've got a good chunk of time. As I did mention, it's recorded, so you could watch parts of it again, and you might want to just jot down notes or thoughts as we're going through it as well. So I want to begin sort of with your thoughts and put you in the center. So I'd really like you to use you can use either one, your chat window or your question and answer window. So you'll have to find that window to type in. But I'd like you to just quickly give some feedback on what excites you about doing a presentation on driving under the influence of cannabis and alcohol. And that's not meant to be a funny question. I think it's an interesting thing to sort of what might encourage or excite you about getting out into the community and presenting on this very complex topic. So quickly, just share some of your thoughts through the chat window or the Q&A window and send those in right now. You can type in and then hit send, and I'll be able to see what you're doing. I'll echo some of those back out. So definitely bringing out some current data, correcting misinformation. We know there's a lot of thoughts and information about driving under the influence of cannabis, so being able to correct some of that. Yeah, critically, and some of you are indicating a role as a DRE, critical to educate juries, so being able to talk in those sort of expert opinions, dispelling myths. Being able to answer questions that folks have. So that's great. Thinking about it through that lens of how do I answer those questions that are coming up. Being able to discuss the additive impact of alcohol and cannabis. Great. Understanding what they're viewing as how they drive is also about their just general social norms about cannabis. Understanding our baseline. What is going on with society and these trends towards perhaps permissibility of drugs or substances, and what's going on with the two most widely used substances, cannabis and alcohol, for sure. It's a new topic. I think that is true. I mean, it is, I think in this field, we have to look at that notion of I know for myself, I've done a lot of conversation about alcohol and other things. So this is a new topic to talk about. And very much an opportunity to encourage community to change their behaviors, presenting factual information. So those are great. I really appreciate you sharing those and also just taking that minute to connect for yourself. I think it is important to revisit that as a presenter, like what excites me about this topic. So there was a question, is there audio through the computer? I can't hear it, but when I test it, I hear the test sound. So there that should be an option. You can also dial in is the guaranteed option to hear the audio, but my audio should be coming through your computer system as well. But if it's not, you can either try to figure it out quickly or hop on the phone. Other people said they had to get on the phone, so the phone might be the best option. Now I'd like you to chat or text in, either one of those. What worries you about doing this presentation, about going out in community and talking about driving under the influence of cannabis and alcohol? So go ahead and just send in your thoughts on that. So not being a subject matter, for sure, expert. What there's so much we don't know. This is extremely important. The research is way behind the practice, so we're still really catching up. What if I can't answer questions and get pushback, especially from youth? The amount of marketing and community norms work to make cannabis okay, and we've got a real industry that is maybe countering our messages. Being permissive when we don't know what is impairment. Yeah. Pushback from the cannabis community. The misconception that it won't happen to me. Yep. That's always out there with traffic safety and all these issues. Pushback from just people who feel like they know it all. So I think those are great comments. And I think, we all feel that, all of us going out talking about a new topic or any topic. And so it's good for us also to acknowledge that and to be connected and understand that. So with that, I'd like to begin. I think this is, for some of us, a more challenging topic to talk about maybe than other issues, but let's just talk about some tips for presenting challenging content. And where I would begin is, and this is where I personally begin, especially if I'm going into what I consider a challenging room, is I just revisit for myself, why am I here? Like what's my role? And I think for the vast majority of you all doing this work, being on this webinar, it's really around improving traffic safety. It's improving public health. It's helping folks be safer. And that's valuable to reconnect with and to rest into. That is a very valuable and shared value across communities. There are very few people who are going to be opposed to improving public health or opposed to public safety or traffic safety. They may not agree with the ways that we're doing it, but in general, folks overwhelmingly are going to align with that. So deep down, even if people are disagreeing with what you're saying, it's important for you to rest into this notion that your work is very valued, important, and that people would ultimately, I think, align with the value that you're seeking, which is to improve public health or traffic safety. When we think about changing people's behavior, and improving traffic safety is going to require us to change behavior. I mean, traffic safety is not going to get better if behavior doesn't change. If we keep doing what we've always done, we'll get what we've always got. So it is going to be about changing behavior, and it's valuable just to pause a minute and think about, well, how does behavior change? And our lens for doing this work at the center is a behavioral model. We look at behavior as being influenced by a belief system. And so people's beliefs will influence the behavioral choices that they make. Now, we very much acknowledge that this becomes complicated when we start talking about addiction, and that addiction can absolutely change the way that the brain is wired and can move away from rational decision-making to very complicated decision-making. But in the basics of behavior, and we want to think about a variety of behaviors. It's not necessarily just the behavior of choosing to drive after using. There are lots of other behaviors too, like having conversations about this, or having family rules about not doing this, or about having workplace rules, or about not putting ourselves in a situation where we'd have to drive after using. So there are a whole wide variety of behaviors we can think about. But we would want to back up and say our work, if we want to change behavior, is then about changing these beliefs. We're going to connect to various values. That's going to help us establish a degree of trust. Values around safety, for example, which are very broadly shared. We're going to need to challenge some people's assumptions. People have assumptions. Some of them are accurate, some of them are inaccurate, and part of our work is going to have to shift some of these assumptions. We're going to have to change people's beliefs, their behavioral beliefs. We're going to look at some of those, their normative beliefs, what's typical and expected, and their control beliefs. And the survey that we did brought all those out. We're going to talk about some of those, but we're going to need to change some of those beliefs. And those are going to influence their willingness and intention to engage. And so when I go into a presentation, I think ultimately, yes, I want to start influencing people's behavior. But the way I'm going to do that is by influencing their beliefs. So I view my presentation as an opportunity to start shifting beliefs. Now, I'm not going to achieve total belief change in any single intervention, but it's helpful for me to realize a presentation is an opportunity to start shifting beliefs. And Shelley opened it up with a really important idea, and this idea of conversations. And what our view at the center is, if we really look at the core mechanism to change people's beliefs, it's conversation. Most of those conversations that change belief will be conversations that I have with myself. Sometimes I'll have those conversations with other people. But really, to change our beliefs, we've really got to sort of noodle it. We've got to think about it. We've got to talk to ourselves about it. And so conversation is absolutely critical to belief change. And in a presentation, we're just going to start that process. So really thinking about our work as changing people's beliefs, I think, is important. And then thinking about a presentation as an opportunity to start those conversations, to start people questioning even some of their beliefs. So I want to share some ideas that we got from one of our colleagues, Nandi. She's a professional hourly employee for us, so that she works part-time for us. Anjali's got a background in substance misuse treatment. So she used to run treatment centers, in particular for adolescents. She continues to do that work with folks who are sort of really challenged and had a lot of interaction with the legal system. But she's also very good at moving out to the systems level and thinking about this work of changing beliefs. And she has the ideas of applying MI, and I apologize, I used an abbreviation there. MI stands for Motivational Interviewing. So we have a video, and we actually sent a link out. Hopefully you got it through the general broadcast email. If you didn't, we're going to show you and make sure that's available. But you will be able to download or watch this video online, and Anjali's got some great ideas about presenting challenging information or advocating for the positive is how we set it up with her. So I'm just going to share some of Anjali's ideas. I still strongly encourage you to watch the video. I'd actually watch the video several times and take notes. Anjali's just got some really good ideas there. The topics that she covers are how to provide information that challenges thinking. So if we want to change beliefs, the beginning part of that process is just to challenge existing beliefs. How to initiate the conversation, how to use some fundamental motivational interviewing skills if you're able to actually engage in conversation so the presentation becomes more two-way, how to work with pushback. What are some strategies? And we'll talk a little bit about that when you have pushback. And then how to close a conversation. So all of these are very valuable for anybody who's engaging in presentations or just engaging in conversations. And I strongly encourage you to watch and learn from her video, but we'll share a few ideas now. So one thing she talks about is really connecting as a presenter with what are your goals for the presentation. And I think it's valuable to recognize your goal is really to be present, to listen, and be curious. And that may be, you may feel like, well, my goal is really to change everybody, or my goal is to get them to stop engaging in what we might consider as, bad or stupid behaviors. But really, if we approach a presentation like this with these three things in mind, to be present, to listen, and be curious, this really sets up a stage where our audience might be more successful. And our goals for the audience are to raise doubt and to create emotional arousal. So as Anjali says, we're going to lead the presentation, we're going to lead the conversation with concern and curiosity. Yes, we are very concerned about this topic. We know the data and the issue, and it's our job to improve traffic safety. We're also going to approach it with curiosity because that's going to create a space which allows for the audience to participate better if we ourselves as the presenters are curious. And what we want the audience to really do is to raise their own doubt. Maybe some of my assumptions aren't right. Maybe some of my beliefs are inaccurate. And we want to create a little bit of emotional arousal. And that could be a little bit of anxiety with them that maybe their beliefs aren't aligned. And of course, when we raise any anxiety with folks, they can push back, they can react in different ways. But that little bit of anxiety, that little bit of maybe curiosity with them as well, is what's going to give energy to their belief change. If our audience shuts down or our audience becomes angry, it's much less likely that we'll get belief change. So you might feel like, well, you're really backing off the goals for this presentation. Really, we're getting a goals that are leading to success because we want to create a conversation in the person's head. And that means they have to be connected to the material. And for a lot of folks, this material may threaten them and they may just completely back off. And then we're not achieving our goal. And again, if we look at that little behavioral model at the bottom, our goal is to start connecting with their assumptions, their beliefs, and to create maybe a little bit of crack in their thinking, a little bit of, maybe I do need to think about this more. And that's a huge success for a presentation. So you want to recognize that clearly as a presenter, you create the context. You do have the ability to sort of have the microphone and control the space to a degree. And you want to take that on. That's a power that's given to you as a presenter. I've certainly been in circumstances where I've lost that, but for the most part, I want to go in knowing that I've got that, and I want to think about what context do I want to create, and then really being intentional with creating it. What Anjali would say, and we would totally agree, is it's really important to establish safety. Now, what do we mean by that? We mean a space where people feel safe to hear information they may not want to hear. If people don't feel safe, they are much less likely to really listen and hear what we're saying. they're much more likely to push back, shut down, argue, or other things. So what are some ways to do that? Well, it's a little bit for us to reconnect with our purpose and decrease our stress. If we appeared stressed and anxious when we present, people will pick up on that and they will feel likewise. This is the whole idea of mirror neurons. We pick up on a lot of nonverbal cues from others and we will start to feel similar ways. So we have to relax ourselves, set our own expectations, be concerned, but be curious, be willing to be present and to listen to others and create that space where it's safe for everyone. We need to listen and be interested in their point of view, be sincerely interested in what other folks are sharing, because this is an opportunity for us to learn, to get better, to see what's going on, to see how the public is or individuals are seeing these issues. We definitely want to express empathy. Expressing empathy is an opportunity to build safety. Now, what does this look like? So empathy could look like maybe you're sharing some of this information and somebody says, I just really have a tough time with this because this contradicts other information I've read. I mean, I've read stuff online that says it's perfectly safe. And I just can't agree with what you're saying. There are lots of ways to respond to a comment like that, but one is with empathy, and that could really disarm the person. And what empathy could look like is, oh, I really hear that you're feeling uncomfortable with the information that I'm sharing, or it's creating some confusion or anxiety. Oh, I think that's valuable to recognize. I realize this information could make some of us feel uncomfortable or challenge what we're thinking. So you're just you don't have to necessarily agree with the content that they're saying, but you can share that you empathize with their position of not agreeing or of being uncomfortable. And that will actually disarm them a little bit and allow more information to come in. We'd strongly encourage to avoid arguing or convincing, because honestly, when people argue or convince, they become more entrenched in their own beliefs and are less likely to see or challenge or hear new information. Basically, an argument is an opportunity for me to practice patterns of thinking that I've already established. And by practicing them, they become even stronger. So if I get into a context where people are arguing with me, I'm actually decreasing the likelihood of belief change. I encourage people to use affirmations. Affirmations can create a sense of safety. I'll give you a quick example of this. So I was doing a press release of a project. It was a statewide project. It was around creating tools for parents. And it was a relatively small crowd, but we had some important people in the room. We had the governor, we had the lead of the agency that was sponsoring it, and we had some press. And one of the press sort of asked a really pointed question. They sort of said, what role does government have in telling parents how to raise their kids? And I had answered the last question, so I was still standing at the podium. So I sort of looked first at the governor. I was like, you want to take that? And he was like, no, you can take that. And then I looked at the head of the agency and I was like, do you want to take that? And she said, no, you can take that. And so I was there, last one standing to take the question. And my response is to immediately say, that's a really good question. And that's how I would pose sort of any kind of question, is to first affirm the question, is to affirm the speaker as well, that any question is good and to be brought forward. And it just, again, it decreases some of the conflict, decreases that sense of somebody trying to get something from you, and to really be sincere with that. So if somebody asks a really hard question or a pointed question back, is to be open to that and say, that's a good question. And let them be a participant in the room and not push them out of the room by sort of challenging or being aggressive. And then you have an opportunity to look and listen for defensiveness by others. When others start to become extremely defensive, that may mean you need to reestablish aspects of safety. Defensiveness can look like, obviously, from body language. people checking out, crossed arms, withdrawal, from language that they say. It can be things like yes, but. Those can be signs of defensiveness. And that's just an opportunity where you want to connect back to creating that sense of safety. It doesn't mean you have to agree with them, but it's just, can we create that space of safety so that we can continue having that conversation? And really what you want is their continued engagement. Okay. And then clearly staying curious. So even with the tough things that come, you're staying curious, you're staying upbeat, and you may ask questions of them that they can answer. So, how does this feel? Is this information new to you? Different things like that, questions that everybody can respond to and give that space for ongoing curiosity. So those were some quick ideas. I did that very fast. Anjali does a much better job than I do. And she gives some more examples. So I would encourage you to watch that and think about that. For me, it's just really helpful. And as a presenter, independent of the content, things that I can do to make a presentation go better and to increase the likelihood that I'm creating belief change. So now we want to shift and get into a little bit more of the content of the presentation. So you've got several resources that are going to be available to you. You have a PowerPoint deck that you can use. We're going to go through that here in a moment. You've got a two-sided handout that's got a summary of some of the most important information from the PowerPoint. So that's an easy thing that they can take with them. And you've got another tool, which are some speaking points, which you could use in a variety of settings. Maybe you have less time than to do the whole presentation, or you just need to respond to a particular aspect of it. All of these are available in modifiable ways. So you were going to look at the general content, but depending upon who you're speaking to, you may remove certain content. You may need to add some other content. So feel free to be able to modify those based on the audience that you're speaking to and the context. All right, so now I want to jump over and I'm gonna switch to show the PowerPoint presentation, and hopefully I'll be able to do this. So hopefully now on your screen, you're just seeing the PowerPoint presentation. You will have these exact slides. So we'll just walk through. So this is just the general opener. The slide is branded with Target Zero, which I think is a good brand to begin with. And you might need to explain to folks what Target Zero is. And the topic of the presentation is, looking at Washington's traffic safety culture, and specifically about driving under the influence of cannabis and alcohol. So during this presentation, we're going to cover three big areas. We're going to look a little bit at the Target Zero culture. We're going to specifically look at our current culture on driving under the influence of cannabis and alcohol. And then we're going to specifically talk about things that you can do. And this could apply to anybody. All of us can contribute to our traffic safety culture. And so we'll talk about some of the ideas of what you could do as a person to help improve our traffic safety culture. Let's first just chat a minute about culture. Culture is a very complex topic and has lots of different ways to think about it. And in some ways, culture is almost like asking the fish, like, how's the water? And the fish sort of looks at you a little bit puzzled and sort of says, what water? Right? Because the fish may not even be aware of the water that it's always in. And that's an aspect of our own culture. I mean, we're immersed in our culture. And sometimes we don't even stop and sort of say, well, what is our culture? And how do we even define that? Or what does that mean? And so it's valuable just to stop and pause and check in with an idea of what do we mean by culture? This is the definition that we use for culture as the shared values, assumptions, and beliefs of a group of people that influence their behaviors. Now, this is one definition of culture. I want to make clear that it's not the only definition or even the right definition. It's a definition, and it works well in a traffic safety context because we can measure it, we can change it, and we can show how it relates to behavior and consequences. So I don't want folks to get hung up. And when you're presenting, you may have folks who say, I don't agree with that definition of culture. And that's okay. We don't want to get stuck or claim that this is the only definition. But what we're going to look at here are just some of our shared values, assumptions, and beliefs, in particular about traffic safety. And the group of people we're going to look at are going to be folks in Washington State. And of course, we could look at other groups, and we encourage to that. We could look at what is our traffic safety culture within our organization. I mean, as an organization, what are our shared values and assumptions and beliefs? We could look at it as a county or a TZM region. So there are lots of different ways that we can be a group of people. We're not going to go through the details of this behavioral model, but in order to figure out what assumptions, values, beliefs we need to look at, we use a behavioral model. And this is a model that has an enormous amount, decades of science behind it. Not that we did, lots of other researchers have done in a lot of different contexts. And so this was the tool or the framework we used to design the survey to specifically look at the values, beliefs, and attitudes that influence driving under the influence of cannabis and alcohol. But we just want you to know there is a lot of science behind figuring out sort of what beliefs are most important. Some beliefs aren't relevant to driving under the influence of cannabis and alcohol, and other beliefs are. And we want to use good science to figure out which beliefs we want to focus on. So let's begin with just some concerns about impaired driving in general. Alcohol and drug impaired driving is the leading contributing factor to Washington fatal crashes. So clearly, when we think about a goal of zero fatalities and serious injuries, we're very concerned about risk behaviors that are major contributing factors. And alcohol and drug impaired driving is the biggest one in Washington State. Polydrug driving, this is 2 or more drugs, is a factor in 1/4 of Washington's crashes. And you will see in a moment that trend is growing. And for sure, we're considering alcohol as one of those drugs. Here's what we're seeing in the trends. So we can see polydrug has been growing over the years. That's the green line at the top. We can see orange, which is a BAC greater than 0.08. So this is, over the BAC level. That's been maybe coming down a little bit, but in general kind of has somewhat of a flat trend. And what we're seeing with just one drug, a drug positive for only one drug or alcohol less than 0.08, that's at similar levels, and that may be coming up a little bit. But this polydrug, so where we're seeing multiple drugs on board, alcohol and other drugs, is definitely a significant component of these impaired driving crashes. We also know that cannabis use is increasing. So past year cannabis use by adults in Washington has increased by 85% in the past 9 years. Clearly legalization has a role there, but it's just becoming a more prevalently used drug. So we're clearly concerned about then driving after using it. And weekend nighttime drivers testing positive for THC increased by 50% from 2007 to 2014. And that's through, biometric testing. We'll also see in terms of self-report, but even by biometric testing, it's going up. So we know both use of cannabis is going up and driving under the influence of cannabis is going up as well. So definitely reasons to be concerned. In 2014, 11% of weekend nighttime drivers reported they had driven within 2 hours of using cannabis at least once in the past 12 months. So when we think about risk, that's a high level of risk. Granted, most people are not doing it. So when we look at broader cultural norms, we're going to talk about that. Most people aren't doing it. So from a cultural standpoint, not everyone is doing this. But from a public health standpoint, way too many folks are. In 2016, polydrug drivers, including alcohol, involved in fatal crashes were more than twice the number of alcohol-only drivers and more than 5 times the number of cannabis-only drivers. So combinations are clearly a concern. More and more research is coming out. As I mentioned at the beginning, we're a little bit behind the times in terms of the research, but there's more and more research studies coming out. So the Institutes of Medicine, now the national, really folded into the National Academies of Science, of Engineering and Medicine, came out with a statement that there's substantial evidence of a statistical association between cannabis use and increased risk of motor vehicle crashes. So that's a strong statement from a very scientific body. A meta-analysis of 66 studies shows that the risk of being involved in a crash increases when using cannabis. And drivers under the influence of cannabis are more likely responsible for a fatal crash than non-intoxicated drivers. So there's going to be, maybe pushback on this topic, but the data is, we're just behind, but there are more and more studies coming out confirming this idea that cannabis use, driving under the influence of cannabis, increases crash risk. So what we did at the center was to then develop a survey and implement that survey to better understand the culture, the shared values, attitudes, and beliefs and behaviors of people who drive under the influence of cannabis and alcohol. And we wanted to look also at some of the shared values and beliefs about intervening with those people. Are people comfortable speaking up and asking that person not to drive or do something else as a way of intervention? So we wanted to look at that as well as a protective factor that we could grow. The survey was done in concert with the North American Research Center, and it had 870 participants who were ages 18 to 65 living in Washington. It's a statewide representative sample. It was done through an online as well as telephone recruited methodology. And we defined driving under the influence of cannabis and alcohol as driving within 2 hours of using marijuana and alcohol. Now, we need to talk a minute about why 2 hours. First, we want to be very clear. 2 hours is not a magic window. Driving after 2 hours since consuming cannabis and/or alcohol is not safe. This was used so that we could make comparisons with other surveys, because historically surveys have used this 2 hour window. So the 2 hours was used for survey purposes only. It is not assessment of safety. It's easier for people to recall as a look back period 2 hours than longer periods of time. And it's consistent with other surveys that we wanted to make comparisons with. So that's why 2 hours was used. We absolutely need to discuss the fact that people can still be impaired and should not drive even after 2 hours. And it's very complex with cannabis, especially when we think about edibles. Because with edibles, we could still be having THC levels significantly increasing after 2 hours because it's only moving out of the stomach and into the digestive system and could take quite a while to process. So 2 hours is not a safety window. It was an assessment window that we used in order to be able to measure something and compare it with other surveys. So what did we start to learn? Well, first off, we learned that most people, 74%, that's about 3/4 of the people, agree the only acceptable number of deaths and serious injuries on our roadways should be 0. So this is starting to look at some of our shared values. 74% is a high level of agreement. It's not everybody. We'd like that to be 100%. But let's be clear, that's a very strong shared value within a culture. 91% agree that it's the responsibility of the driver to comply with the laws of our roads. Now, we want that, again, to be 100%. But this is a good place to start. We're not starting from a place where most people think they can violate the laws. Nor do we ever want to say anything that implies that. We want to clearly state, hey, most people agree it's the responsibility of the driver to comply with the laws. And that's where we're going to begin the conversation. About 2/3 of the people agree that impairment begins with the first sip of alcohol. This is an assumption. This isn't a value. This is an assumption. Impairment absolutely begins with the first sip of alcohol. It's degrees of impairment. Some people falsely think, well, I'm not impaired until I reach a 0.08. That is false. it's degrees of impairment. And in fact, some states have moved below 0.08. Utah's moved to a 0.05, and other countries have moved to 0.05 and even 0.02. So we need to start getting this out and challenging that 1/3 of the people who don't understand that impairment begins with the first sip of alcohol. And about 3/4 agree that impairment begins as soon as you start consuming cannabis. We need that to be 100%. But these, again, are good places to begin. So when we think about our culture, we have a positive culture to begin with. Does that mean everybody agrees? No. But we have a strong place to begin with. And as a presenter, you want this to really sink in and know that the vast majority of people in any given audience are still aligned with this. Everybody? No. But most people, yes. Now, let's look at some engagement in risky behaviors. Most people don't drive within 2 hours of consuming alcohol. That's 78%. But we're very worried about that 22% who do. Now, 22% in Washington State is somewhat similar we're seeing in most states. So it's not that Washington State is particularly high or particularly low, but we'd really like to drive that 22% down to zero, right? We really don't want people driving after consuming alcohol. 85% don't drive within 2 hours of consuming cannabis. We're very concerned about the 15% who are. And 9% reported driving within 2 hours of consuming cannabis and alcohol. So again, from a cultural standpoint, we've got strong protective behaviors going on. Most people are not engaging in risky behaviors. From a public health standpoint, we have way too many people engaging in risky behaviors. 22%, 15%, and 9% are way too high. I mean, just think about that. If you're out driving on the highway and you pass 1,000 cars, way too many folks could be impaired or under the influence. So these numbers have to be way lower in order to really create a safer environment and to get us to target zero. Most adults in Washington have a negative attitude about DUICA. In other words, they think it's not something we should do. We're very worried about the 19% who don't have a negative attitude. They may have a neutral attitude and some may have a positive attitude. Those who do have a positive attitude were twice as likely to engage in the risky behavior. They're more likely to believe that driving under the influence of alcohol and cannabis improves their driving. We're going to talk more about that. And they're less likely to believe that they're at risk to be arrested or to be in a crash. So these are beliefs that we need to shift. They need to understand that they are potentially likely to be arrested and they are more likely to be in a crash. And absolutely, driving under the influence of alcohol and cannabis does not improve their driving. So these are beliefs we've got to shift in order to grow more of that negative attitude. But again, our culture is strong. We've got a strong place to begin, but we have work to do. Most adults believe it is unacceptable to drive within 2 hours of consuming alcohol and cannabis. This is called an injunctive norm, what we're expected to do. 83%, that's a good place to begin, but we need to address the other 17%. And again, people who perceive that it is acceptable are more than 4.5 times as likely to do it themselves. So we need to help folks realize this is not an acceptable behavior. Most adults don't do it. Most adults don't drive within 2 hours of consuming alcohol and cannabis. However, there are a number of people who think most people do it. That's a significant misperception. Those who perceive that most people do engage in this behavior frequently are twice as likely to do it themselves. So we've really got to correct some misperceptions. Overwhelmingly, people don't think this is acceptable, and overwhelmingly, most people don't do it. And so these are false beliefs that people have, and we need to help correct those. Now, people who engage in the behavior may be thinking that using cannabis calms them down and sobers them up when they've had too much to drink. That came out in the survey. About 3/4 of the people who engage in the behavior are likely to feel anxious after drinking and use cannabis to calm themselves down. About half are likely to feel too impaired after drinking and then use cannabis to sober up. These are false beliefs, but people are feeling that they're calmer or they're more sober and that it's okay to drive. So we need to help people understand, even though you may feel better, you're not safer to drive. That's a misperception you're having. So this is an example where we want to create a safe space for someone to say, yeah, I do feel calmer. Maybe I'm not safer to drive. And that's a huge belief shift that somebody might start to have through this presentation. So we want to crack that assumption that they have, that they're actually safer to drive when in fact they're not. Now, let's shift and talk a little bit about bystander intervention. We wanted to see, are people in situations where they recognize somebody else who shouldn't be driving? And it definitely came up. People are in situations where they're able to say, I think maybe that person shouldn't drive. And most of them are taking some sort of steps to prevent someone from driving. They do things like arranging or providing a ride, arranging the person to stay, or engaging somebody else to help. I mean, that's always an opportunity, is to get some more help. You don't have to do it by yourself. And sometimes that might be being prepared to call 911 if the person drives. It's that recognition that we'd rather have them arrested than to kill themselves or somebody else. So it's important for us to recognize that we create our culture. Sometimes we lose the sense of that. We have this sense of culture's out there and I can't do anything about it. But absolutely, we create our culture. We have voices. We can create an accurate perceptions. We can talk about our beliefs and share our values and help grow them. And this is something we want folks to be empowered after the presentation to do. So absolutely, you can share and discuss these results. As a result of people coming to this presentation, I hope they go out and share this information for others. I hope they open the door so that I can come and share this presentation with others. We want to leverage the existing positive shared values and attitudes and beliefs. We don't have to come at this challenge from a deficit place. We can come from a strength place. We've got a lot of strong values and attitudes in Washington State. Let's build on them. We need to correct some important misperceptions. Driving under the influence of cannabis and alcohol is not safe. Most people believe it's unacceptable. Most people do not do this. And using cannabis after drinking does not make it safer to drive. So these are important beliefs we just need to say over and over and over again. We can think about all of our current efforts. I mean, all of you are involved in efforts, and as you deliver this presentation to others, they will be involved in efforts and have programs. Those existing programs, strategies, and communications are opportunities to infuse this information. So let's see how we can add this information into what we're already doing so people can hear it from multiple sources. And we can absolutely grow bystander engagement to prevent impaired driving. If people are in circumstances where they see a risky behavior about to take place, let's empower them to do something about it. So we can integrate safe bystander engagement into our practices, our existing programs and strategies. I mean, do we talk about this when we're talking about not drinking and driving? Do we also talk about, hey, you can also speak up if you see somebody who shouldn't drive? Absolutely, we need to talk about what doing this safely looks like. You do not want to promote ever disabling a vehicle or allowing impaired people to walk or using any kind of physical intervention. All of those are extremely dangerous. We need to be very cognizant that impaired walking is a major concern, and very much in rural areas, but everywhere. But rural areas, it is absolutely not safe to walk home. People can walk into the roadway and be hit. People can walk off the roadway and freeze to death, all sorts of problems. So walking is not a solution. We can promote safe strategies like arranging or providing a ride for the person, having the person stay where they are, engaging others to help, and yes, being prepared to call 911 if that becomes necessary. So this is where the presentation, would conclude. You'd have an opportunity to open it up to folks so that they could ask questions or share comments. This is where you're going to continue to create that safe space. You're going to use some empathy with questions, and you're just going to be curious. And it's absolutely not where you have to have the answer to every question. You want to be in a place where you can say, wow, that's a great question. I don't know the answer to that. Let me write that down and get back to you. It's very intimidating to be in a situation if we feel like we have to be the content expert. What you need to do is to create a space for curiosity and a space for folks to be able to start to contemplate and consider this information. You then have a place where you can put your name and contact information so that they can follow up. You can also add that information to the handout so that people can follow up or bring you in later on. So now I'm going to switch back. We're sort of out of presentation mode. We're going to switch back to this broader webinar and sort of talking about this. And I would share one of the great strategies, if you're uncomfortable or worried about presenting information, is just to practice. One of the members of our team, Katie Dively, she's our lead trainer. She's an outstanding trainer. And she practiced her presentations endlessly with her golden retriever. Her golden retriever is one of the best educated prevention specialists in the state of Wisconsin, because that golden retriever has heard presentations over and over again. Now, sometimes you might not want to practice with your golden retriever, your dogs. Just get out with any audiences you can, and you can very strategically pick safe audiences. But I've learned myself as a presenter that after I do a presentation 5, 6, 7 times, I'm a lot more comfortable with it. So how do I get to 5 or 6, 7 times? You just got to get out there and doing it. And then you can sort of rest into, you'll know what's on the next slide. You'll know the basics of the content. And then you can work on the other aspects of your presenting. How well are you connecting with folks? How well are you creating that safe space? And so allow yourself to be developmentally go along. Work on the basic content first, then work on your other aspects of your presentation. But absolutely, the more you do it, the more grounded you'll get in it. So I now want to pause and open it up to any questions or comments you can have. I will look at them if we're recording it, so it's a little bit easier if we don't open up the audio. But if you can text in or chat in your questions, we can look at that. So one came in, please explain why the slide shows adult use at 18 when the law is 21. So good. We did look at age 18 in terms of the survey respondents. That's always a question that comes up, sort of how might we delineate adults and different things. We looked at age 18 because in the United States, it is the age of majority. We also know that risky behaviors, especially with alcohol, and I think as we're seeing with cannabis, have a higher prevalence with younger folks. So that 18 to 25-year-old population tends to be the highest users, especially high-risk users of alcohol. And I think we'd also see the most consumption of cannabis right now with them. That may be shifting with legalization. So we do elect to include 18 in that mix, even though the law is 21. We do that with alcohol as well as doing that with cannabis. Any other questions or comments? Or thoughts? I mean, yeah, it can be a comment too. I mean, it doesn't necessarily have to be a question. Anything you want to text in either through the question box or the text box. So I'll give it a second. This is where I do the Jeopardy music. All right, so not a lot coming in. That's fine. So I will, even though you didn't text anything in, I will ask you a question. What surprised you or was new information from today's webinar? So go ahead and try to respond to that. Text in or chat in any thoughts you have on that question. And again, I'm trying to model also what I'd encourage you to do. If you're in a presentation and you don't have a lot of response from an audience, ask them a question. And this is always a great question, sort of what surprised you or what was new? So that's a good one in terms of, do we use the word marijuana or cannabis? All right, so this is an interesting concept and topic. We at the center tend to always want to use the word cannabis, and we do it quite intentionally. Now, on our surveys, we use the word marijuana because the general public is still very much aligned with the word marijuana. We use cannabis because it's the official name of the drug. There's also evidence that the term marijuana was widely brought out to label the drug cannabis in order to create an association with individuals from Mexico, and that was done as a disparaging effort. If you look at the history of substance prevention in the United States, some of the most early work, some of the first legalization work was actually done in California, believe it or not. And it was done around early use of coca and early forms of cocaine. And it was done aimed at Asian populations, largely because there was a threat of employment. It was not done to improve health and safety. It was done as a way to discriminate and separate immigrant populations. And regretfully, that pattern has shown up several times in the United States when we look at issues of drug control policy. So we at the center really move away from using the term marijuana because that word does have a degree of association with that sort of historical approach in terms of creating discriminatory practices towards Mexicans, and really like to use the word cannabis. In the science field, they use cannabis. Other countries widely use cannabis, so we really feel cannabis is an appropriate word. So some folks were interested in terms of significant facts showing the danger of impairment. Good. I think that is an area where we need to bring more and more facts out. So it's different hearing the reaction to, oh, it is just DUI versus that most people see it's a driver's responsibility to comply. So good. So starting to bring some of that information out. So whether cannabis is being used as somebody brings up, is cannabis being used as a healthier language than marijuana? Could be, but I still feel the issue around some of the history is important for us to acknowledge. I don't think we want to hide the fact or confuse people that it's a different drug. We very much want people to know marijuana and cannabis are the same thing. So yeah, we don't want it to be confusing for folks. Okay, well, thanks for sharing some of those thoughts. In terms of some next steps, you'll absolutely be able to download information at a Washington Traffic Safety Commission site. Shelley will email out the address of that site. They have a special site where there's specific information for folks like you working on improving traffic safety and working on the Target Zero work. So that site will have access to the presentation. If you wanted a link to this recording of the webinar, those other materials, as well as access to the recording by Anjali. We'd strongly encourage you to start sharing the information. Feel free to start with small, safer groups, anybody you're comfortable speaking with. And again, when we start thinking about growing culture, the goal is to talk to lots of different folks because all of them can be empowered as voices of the culture and be able to share that with others. There Washington Traffic Safety Commission is developing an evaluation for participants, which I think is great. They're both, I think, exploring the idea of definitely creating a paper evaluation and maybe looking into the opportunity of creating a online evaluation that somebody could do very quickly on their cell phone. That can be, for younger audiences, maybe a higher response rate because they can just complete the evaluation right at the end of the presentation on their phone. And it can get you responses very quickly where nobody has to collect or code those. But obviously for some audiences, a paper evaluation is good as well. But that's a good way for us to start to see what people are connecting with the presentation and collect some data over time. Shelley and her crew are also excited to create a contest. So they will be creating an unbelievable prize for the person who gives the most number of presentations and a separate prize for the person who reaches the most number of people. So it can be both the person who does a lot of presentations as well as if you do some presentations with some really large audiences. And I think Shelley will be following up with the details of that. All right. So you can also feel free to contact Shelley to request changes to the materials, updates to the materials, or additional resources. So that if there are things you wish you had, just ask, and she will see if there's any way to help to develop those and provide those for you. And we just wanted to mention that we are working with the Traffic Safety Commission to on a shorter project, but to really start to explore how we can grow bystander intervention, bystander engagement. What are some things, some tools we can put together to do that? What are some ways we can also evaluate those tools in a structured way? And so we're very excited about that opportunity to, again, down the road, bring more resources for you so that you can also promote this idea of bystander intervention. We know this is not, that impaired driving as a big picture issue is not an issue that we're going to be able to enforce our way out of. We simply can't look to law enforcement and say, look, you guys have to solve this. Absolutely not. It's everybody's role, and everybody can have a role in it. And our surveys show more and more that in vast majority of circumstances, somebody is around and can make can take a stand and seek to intervene. Another question popped up: can we add our own organizational logo anywhere as a part of the presentation? I think the answer to that is yes. That was part of why they wanted to provide those resources in a modifiable format so that you can co-brand with it. And do you have any information on the increase of daytime DUI with cannabis? I think from the daytime, from the roadside survey, there was some results on that and showing that daytime DUI was increasing, but we'll look into that to find more information. In general, with polydrug, I think they are seeing more daytime interactions definitely occurring. So we are seeing other substances in fatal crashes appearing during the day. It's not just a nighttime thing like maybe we were more used to with alcohol. So that is certainly a change. All right. With that, I want to come back. Shelley, do you have anything else you want to say to close us out?
Yeah, thanks, Jay. You did a great job. I hope everyone enjoyed the presentation as much as I did. I've heard this many times, and I still learn something every time I hear it. There was a question about why are we using adults age 18 plus when legal age is 21, and I think that's coming from slide number 8 where we say past cannabis use by adults, parentheses, age 18 plus. And I think maybe that's a really good point. We can change adults to people. And then Jay answered the question as why we're looking at that age group. So hopefully that helps. No, it was just because we had data that we wanted to use. But that's a really good example. I'd encourage you all to look through the materials, to get back to me personally if you think things need to be changed, to modify for your own groups that you're going to be talking to, the time period that you have to talk to them. And we'll be getting out a link that you guys will be able to let me know how many presentations you've done and how many people you've presented to, and we will be doing an award We'll close the contest September 30, hoping that you continue doing the presentation, but just that's the end of our fiscal year, and I will come up with great prizes for those 2 people. So, Jay, thank you so much, and everybody that's on the phone today, thank you. We'll be sending some follow-up emails to the whole list of people who registered, so you can get the website, you can have my contact information, and we are really excited to know who's able to give this presentation and what kind of results they got. So let's all stay in touch.
So wonderful. Yes. Thank you all for the great work you're doing in Washington. Washington does have a great traffic safety culture, and it's because of the work that you're doing. So that's just great. So thanks for your time today, and we look forward to future conversations. Take care, everyone.